Hello, I'm Joan Stauffer with Iridex Corporation here at the American Academy of Ophthalmology. It's Iridex's day 2 of our 3-day physician speakers program celebrating 20 years of our MicroPulse technology. I'm here with Dr. Jonathan Feistman from New York City Retina, who just presented in our program. Dr. Feistman, thank you for being here. Can you briefly explain the difference between MicroPulse technology and continuous wave?
So with continuous wave, that's the old traditional focal that we used to do, and that would show a visible burn. We've known over the years that that burn can grow over time, but even more importantly, we always have concerns and worries that you may laser the fovea, and that's something that we try to avoid. So the nice thing with MicroPulse, it's a safe pulse, it's a smaller pulse. It's been shown and proven to be as effective, and it's safe.
And how long have you been utilizing MicroPulse in your practice, and what are some of the different indications that you treat with MicroPulse?
So we've been using it for 4 years. Ever since we started our practice in New York City, we bought a MicroPulse, and one of the reasons why we wanted to buy it is because we want to have all the tools available to us to help our patients and help our referral doctors. And we don't want anything out there that's useful that can help them that we don't have. And that was our thought process to getting a MicroPulse laser. We all do tons of injections. There's a lot of patients that have edema. So we've got retinal vein occlusions that respond very, very well to anti-VEGF, but they need a lot of injections, and they're always asking me, when can I come off it? So that's a good time where you could either use it early or use it at the end when you're trying to extend them out a little bit more. So that's a good time to use MicroPulse laser. I could tell them, listen, there's zero risk on this. Let's do it. Your fluid's getting a little bit worse. And if it gets even worse than that, we'll have to start incorporating anti-VEGF as well. But like some of the examples that I showed this morning that we talk about, sometimes the MicroPulse is enough. And then now we just avoided doing any injections on these patients, and so that's always a nice thing as well.
So for your physician colleagues who are still skeptical about MicroPulse, what would you say to them?
I mean, I would say that it's an excellent added therapy, an extra added tool in our toolbox to help out all these patients. People are still worried about lasering the fovea just because we were all brought up not lasering the fovea and how dangerous it is. I have it so ingrained in me about not lasering the fovea that now I do it in the peripheral macula, and then I go to the middle just because I feel like I'm doing everything as safe as possible for the patients. You just do the standard settings. You can laser the edema. It's super fast, and that way it's less than a minute of treatment. So if you're skeptical about it, I would say, there's something in between watching patients and doing a ton of injections. And this is what's kind of in the middle, and so that's the nice thing about it.